Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about CMS proposed rule for fiscal year 2024 Inpatient Rehabilitation Facility Prospective Payment System. Let's get started. On April 3rd of 2023, the Centers for Medicare and Medicaid Services, or CMS, issued a proposed rule to update Medicare payment policies and rates under the Inpatient Rehabilitation Facility, or IRF Prospective Payment System, or PPS, and the IRF Quality Reporting Program, or QRP, for fiscal year 2024. CMS is publishing this proposed rule in accordance with the legal requirements to update Medicare payment policies for IRFs on an annual basis. Proposed updates to the fiscal year 2024 IRF PPS payment policies. For fiscal year 2024, CMS is proposing to update the IRF PPS payment rates by 3% based on the proposed IRF market basket update of 3.2% less a proposed 0.2 percentage point productivity adjustment. CMS is proposing that if more recent data becomes available, for example, a more recent estimate of the market basket update or productivity adjustment, CMS would use these data, if appropriate, to determine the fiscal year 2024 market basket update and the productivity adjustment in the final rule. In addition, the proposed rule contains an adjustment to the outlier threshold to maintain outlier payments at 3% of total payments. This adjustment would result in a 0.7 percentage point increase in outlier payments. CMS estimates that overall IRF payments for fiscal year 2024 would increase by 3.7% or $335 million relative to payments in fiscal year 2023. Proposed modification to the excluded unit regulation. CMS proposes to allow hospitals to open a new IRF unit and begin being paid under the IRF PPS at any time during the cost reporting period, provided the hospital notifies the CMS regional office and the Medicare administrative contractor in writing at least 30 days before the date of the change and maintains the information needed to accurately determine the cost attributable to the IRF unit. Such a change would also remain in effect for the rest of the cost reporting period. CMS believes this will alleviate unnecessary burden and administrative complexity placed upon hospitals and increase access to care. Rebase and revise the IRF market basket. Approximately every 4 years, CMS rebases and revises the IRF market basket used to update IRF PPS payments to reflect more recent data on IRF cost structures. CMS last rebased and revised the IRF market basket in the fiscal year 2020 IRF PPS rule, where CMS adopted a 2016 based IRF market basket. The proposal for fiscal year 2024 would be to adopt a 2021 based IRF market basket and includes proposed changes to the market basket cost weights, price proxies, market basket update, and labor related share. Proposed updates to the IRF Quality Reporting Program. The IRF Quality Reporting Program is a pay-for-reporting program. IRFs that do not meet reporting requirements are subject to a 2 percentage point deduction in their annual increase factor. In the fiscal year 2024 IRF PPS proposed rule, CMS is proposing to adopt the discharge function score measure beginning with the fiscal year 2025 Quality Reporting Program. This measure assesses functional status by assessing the percentage of IRF patients who meet or exceed an expected discharge function score and uses mobility and self-care items already collected on the IRF Patient Assessment Instrument, or IRF PI. The adoption of this measure would replace the application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan application of functional assessment/care plan measure. Adopt the COVID-19 vaccine. Percent of patients/residents who are up to date measure beginning with the fiscal year 2026 IRF Quality Reporting Program. The measure reports the percentage of stays in which patients in an IRF are up to date with recommended COVID-19 vaccinations in accordance with the Centers for Disease Control and Prevention's or CDC's most recent guidance. Data would be collected using a new standardized item on the IRF pie. Modify the COVID-19 vaccination coverage among healthcare personnel or HCP COVID-19 vaccine measure beginning with the fiscal year 2025 IRF Quality Reporting Program. This measure tracks the percentage of healthcare personnel or HCP in IRFs who are considered up to date with recommended COVID-19 vaccination in accordance with the CDC's most recent guidance. The prior version of this measure reported only on whether healthcare personnel had received the primary vaccination series for COVID-19, while the proposed modification of this measure would require IRFs to report the cumulative number of healthcare personnel who are up to date with recommended COVID-19 vaccinations in accordance with the CDC's most recent guidance. Remove 3 measures from the IRF Quality Reporting Program beginning with the fiscal year 2025 IRF Quality Reporting Program. The measures CMS is proposing to remove are the application of functional assessment/care plan measure, the IRF functional outcome measure, change in self-care score for medical rehabilitation patients measure. And the third is the IRF functional outcome measure, change in mobility score for medical rehabilitation patients measure. CMS proposes removal of the application of functional assessment/care plan measure because it meets conditions for measure removal factors. 1. That is, measure performance among IRFs is so high and unvarying that meaningful distinctions in improvements in performance can no longer be made. And 6. That is, the proposed DC function measure is more strongly associated with desired patient functional outcomes. CMS proposes removal of the change in self-care score and change in mobility score measures because they meet the condition for measure removal factor 8, that is, the cost associated with the measure outweigh the benefits of its use in the IRF Quality Reporting Program. Additionally, the change in self-care score and change in mobility score measures are similar or duplicative of other measures within the IRF Quality Reporting Program. Begin the public reporting of the transfer of health information to the provider, PAC measure, and the transfer of health information to the patient, PAC measure, beginning with the September 2024 Care Compare refresh or as soon as possible. These measures report the percentage of patient stays with a discharge assessment, indicating that a current reconciled medication list was provided to the subsequent provider or to patients or their families or caregivers at discharge or transfer. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.